We're going to start an examination, but before we do, I just wanted to ask you, is it okay if, while I'm examining you, that I videotape and upload it to YouTube?
Yes.
Okay. All right, so this is a musculoskeletal exam. I'm going to start with the hands. So go ahead and hold your hands like this. I'm looking at the joints and the hands and the wrists also for any nodules, redness, deformity, any abnormality whatsoever. Okay, go ahead and turn your hands the other way. Okay. I see skin discoloration on this side, and that's about it. So now I'm going to start with palpation. You can put that hand down. For the purposes of this video, I'm only going to do one side in some cases. In some other cases, I'll do bilateral assessments. Okay, so I'm looking at the joints. This is the furthest joint. It's called distal interphalangeal joint. Proximal, the middle one, is called proximal interphalangeal joint. And the knuckles are called, these joints are called metacarpal, metacarpal phalangeal joints. So I'm going to palpate each one of these joints. I'm assessing for pain and tenderness, for any nodules I might not have seen but can feel. And the wrist. I'm palpating the wrist. This is the ulna and the radial bone. I'm palpating and assessing for tenderness. Did anything hurt when I did it? When I went like this, did any of it hurt? Okay.
No.
All right, now I'm going to do some range of motion on the fingers. I'm going to ask the patient to bend at the knuckles down, and now extend your fingers up. Not your wrist, just your fingers up. Okay, it's tight right here. Now I'm going to ask you to go outward like this with your fingers. That's abduction of the fingers. Now bring them together. That's adduction of the fingers. Now we're going to assess the range of motion on the wrist. I'm going to ask you to bend at the wrist and go down. Okay, and that's a flexion. Now extension of the wrist is come up. Okay, like this. Did any of that hurt?
No.
Okay, go ahead and relax your hand. And that's all the range of motion for the hands, for the fingers, and the wrist. Now I'm going to move up to the elbow. Oh, this area here is the surface ulnar area as well. All right, so now we're going to talk about the elbow. Okay, there's a bone when you bend the elbow. This bone right here is the medial epicondyle. This is the one that can get sore with golfer's elbow, or they can call it the baseball elbow. And the medial one, bend here, this one is the lateral epicondyle, and it tends to be sore with what they call tennis elbow. This is the Olocrian process of the elbow. And so I'm looking at the joint. Is it have any deformities, redness, nodules, things like that? Okay, so now we're going to do range of motion for the elbow. Go ahead and hold your hand here. I'm going to go ahead and do it first. Passive motion, relax your elbow, bring it up. This is flexion, this is extension of the elbow. And I'm going to ask him to pronate, which is this way. Pronate your hand this way. Supinate, no, that's supinate. This is supination, this is pronation. Did any of that hurt?
No.
Okay, now I'm going to ask you to do it by yourself. Hold your arm out. Okay, bend your elbow and extend it. And then make your hand go down with the palm down, and then with it out. Okay, and none of that hurt?
No.
Okay, so that is the elbow. Now we're going to move up to the shoulder area. It's a little more complicated. Okay, so this bone that sticks out from the side, relax your muscles. This bone right here is the greater tubercle of the humerus, and if I move this way, I'm going to find the acromion, and then the clavicle is right here. Where the clavicle and the acromion meet is the supraclavicular joint, which is here. And then if I go down just a little bit lower on the anterior side, I get the coracoid spine or point. And if I come down here, as the bicep muscle connects, there's a little groove here called the bicep groove. It's right in here, it's on the bone. And then in this area, there is a pocket of fluid, and it's like above where the deltoid muscle is attached, and it's just below the clavicular. And when that pocket of fluid gets inflamed, it's sore. They call it a bursa. I think it's called the supraclavicular bursa, or no, subdeltoid bursa in this area. Okay, so those are the areas of the shoulder that we're looking at. Okay, so from the shoulders, we're going to go to the head and the neck. There's the sternum is right here, the top notch is here, and the clavicular, the clavicle where it joins the sternum is called the sternoclavicular notch. It's right here. Does that hurt?
No.
Okay, and now I'm going to look at the cervical spine. I'm inspecting it from C1 to C7 to see if it's got that curvature there. And now I'm going to palpate the muscles in the back to see if there's any tenderness. Could you go ahead and stand up? And then put your back toward me. Okay, so here's C1, palpate down to C7, right in here. The trapezius muscles are about like this, kind of the shape like this. I'm going to palpate them for tenderness. They connect all the way down here, and the rhomboids are underneath. So I'll press a little deeper. Any tenderness there?
No.
Okay. Okay, and now we're going to go ahead and turn back around all the way, and you can have a seat. We're going to do some range of motion of the neck and the head. So I'm going to ask you to bring your chin down to your chest, and then back, up, and then back, go back. Okay, now bring it back to normal there. Now I'm going to ask you to look at me now, but now I'm going to ask you to turn your head from one side and then to the other side. Back and then the other side. Okay. Now as you're looking at me, I want you to bring your head to the side like that, and now back to the middle, and then the other side. Okay. All right. All right. So let's see. Now I'm going to also check the temporal mandibular joint. So I'm going to ask you to open and close your mouth, and then close. Okay. Now I want you to do it again. Uh-oh. It's okay. Okay, go ahead and, do you want a drink of water? Okay. Go ahead and open and close your mouth slowly. Open and close. There's no clicks, or I didn't feel anything different. Did that hurt when you did that? Okay. All right, so now I'm going to ask you to move your jaw like this, side to side, side to side. Okay, good. Okay, now I'm going to ask you to take 3 fingers and see if they fit after you open your mouth. I'm going to do it first. And now you try it. Okay. Okay. All right, good. All right. And let's see, so the head and neck, mouth. Okay, let's go ahead and have you lay down. I'm going to go ahead and examine your feet. I'm going to examine your, I'm going to fix the camera. See if this is as close as I can get. You know, I never turn this light on. See if that helps a little bit. Okay. Now, do you want cough drop? Okay. Alright, so my dad has asthma, and sometimes he's coughing, especially this time of year. So we're gonna go. He'll be okay. We'll go on. Let me fix the camera a little bit better. Okay. So as I'm examining his feet, it's the same as the hands. I'm going to be looking at the joints. Are they inflamed? Is there any abnormalities? Is there symmetry? Things like that. Does he have any calluses or corns? Anything like that? Okay, so now I'm going to palpate. I'm going to palpate the joints. The first joint, just like the fingers, we've got the distal intertarsals and the medial, and then the metatarsals. So I'm going to palpate each one to see if there's any tenderness. Is there any tenderness?
Yeah.
No? Okay, I'm also going to look for Morton's neuroma. It's in the third to fourth. I go down between the head of the third and fourth bone here, and then I press in there. Is there any tenderness?
No.
Okay, and then I'm also going to check to see, there's a test I can see if the patient has plantar fasciitis on the medial side of his foot here, right through here. If he did have plantar fasciitis, it would hurt right through here and then this fascia. So I'm just palpating to see if it causes any pain. Did that hurt?
No.
Okay. Now we're going to do range of motion of the toes. Can you curl your toes like that? Okay, and now straighten them out. Okay, good. All right, that's good. And now I'm going to look at the ankles. Okay, this is the lateral malleolus. This is the, from on this leg, this is the medial malleolus, and then we've got the Achilles tendon back here and the gastrocnemius. So I'm going to palpate this area for pain and tenderness, and then same back here. Any tenderness?
No.
Okay. Okay, so now I'm going to check the range of motion on the ankles. I'm going to do it passively, and then the patient will do it actively. Here's the dorsiflexion, plantar flexion, dorsiflexion, plantar flexion. Okay, now I'm going to ask you to do that. Bring your toes towards your head, and now point your toes. Extend all the way. Oh, sorry. Okay, now I'm going to ask you to make circles with your feet, with your ankles. Okay, good. All right, now we're going to move up to the knee, the knees. All right, so I'm looking also at the joint, at the knee joints. Are they symmetrical? Do they have any abnormalities, any nodules, anything like that that I can see? I did want to say that when the patient was standing, I did note his posture. His knees are straight. Now, if he had any deformities, his knees would knock, and that would be called valgus, because the bones come inward to the midline, and varus would be bow-legged if his knees went out to the sides, and there could be some things that could be done for that, but he doesn't have either of those issues. So now I'm going to examine one knee more specifically. I'm going to palpate about 10 centimeters above the patellar, down toward the patellar notch, there, and then on the side. This could also be done with the leg slightly bent, the knee slightly bent. Any pain or tenderness?
No.
Okay. Now I'm going to assess for Baker's cyst by palpating the popliteal fossa. I do not feel any nodules back here. Okay, so now we're going to do a range of motion of the knees. Sir, I'm going to ask you to sit down with your legs off to the side of the bed. Okay. Let me check the camera. Oh yeah, this is going to be a little harder because... Okay, so we're going to check, we're going to start with a knee extension. I'm going to do it passively, so we're going to extend the knee out. That's extension of the knee. And now back, that's flexion of the knee. And you want this to be about 120, and then the extension of the knee 0. I believe he's about maybe 5 degrees. Okay, so now I want you to do that by yourself. Extend your knee, good. And then bring it back, good. All right, thank you. All right, now let's see. Now we're going to do some tests of the knee. So if you can go ahead and lay back. Okay, so now I'm going to do some tests of the knee. Let me do this. Let me get on this side. Okay, we're going to bend this knee like this. This is called the test that I'm going to do is called the drawer test. I'm going to do it posterior and interior. I'm checking for the ACL, the anterior and posterior cruciate ligaments. I'm going to hold on like this, and I'm going to press posteriorly, pull anteriorly to see the levity of the joint of the ligaments to see if they're loose or tight. Okay, so I did that one. Okay, let me think of the others. At this point, I can't remember anymore, so I'm going to go ahead and go on with the exam, and if I can think of anything later, I will do it. So go ahead and relax your leg there. I'm going to adjust the camera. Okay, so now I'm going to examine the hips. Okay, so patient's going to keep his clothes on, obviously for this exam, but I'm examining the hips. I'm looking at the bony, the ASIS, you can see that. I'm going to be looking for symmetry. Are the hips the same? Are there any nodules, redness, or any type of deformity in the joint that I can see? And I don't see anything, so look on the other, go all the way to look on the other side. Okay, now I'm going to palpate the hips. I'm going to try to locate the superior iliac crest. Okay, it's about right here. And then on the side, I should feel the greater trochanter of the femur. It's about right here. Those are the landmarks that I'm looking for. Okay, now I'm going to ask the patient, he's not able to really lay flat, so I'm going to ask him to turn over to one side. And there's a couple of places back here that we want to look at if I could see better, but I can talk about it. I'm going to try to locate the sacrum. Here's the coccyx, and here's the sacrum. There's a sacroiliac joint where the sacrum and the iliac spine connect, and that joint's about right in this area. I'm also looking at the palpating for, in the sacrum area, there's it's the posterior superior iliac crest. So the other one is up here in the front. This one's anterior, but it's part of the same bone. It's just on the posterior side. Okay, so I would palpate this area for tenderness. Okay, you can go ahead and come back. Okay, so now we're going to do some range of motion of the hips. Okay, so let me check the camera again. Okay, so I'm going to ask you to bring your knee up. So I'm going to internally rotate the hip by rotating this way. That's internal rotation of the hip. This is external rotation of the hip. And now I'm going to ask the patient to bring his knee to his chest. So bring your knee up, pull your knee to your chest. Good. Okay, and then back. I cannot check the hip extension at this time because during rehearsal when I did that, my patient got a cramp in his hamstring, so we're not going to do that, but I can talk through it. The patient would lay flat on his stomach, and I would bend his knee. So if he was on his stomach and his knee was bent, I would passively lift his knee up it would be extending his hip, and then I'd ask him to do that. When I asked him to do that, he had no extension, and that's what probably caused the cramping. So that's how I would check the extension of his hip. Okay, now we're going to go with abduction and abduction and adduction of the hip. So I'm going to ask you to relax, and I'm going to do it passively. I'm going to move his hip laterally, which is abduction away from the midline. And then I'm going to put it back. Now I'm going to assess for adduction. So I would start out here. I would adduct toward the body and across his leg. So that's abduction and adduction of the hip. Again, I would do it bilaterally in a clinical setting. Okay, so now I'm gonna try to conduct some of the hip tests to check for various things, contractures and such. One of the exams is something we kind of already did, is when he brings his knee up to his chest, pull your knee all the way to your chest, and we look at the opposite leg. And if you notice, it did slightly bend. If it's very, very slight, but if the hip's fine, this would be a fully extended leg. If exaggeratingly this was up, then it could be an indication of a contracture on the left hip. Okay, go ahead and put your leg down for just a moment. Okay, so I'm going to try to remember some of the tests for the hips. If I don't remember the names, I'm going to at least conduct the tests. Okay, so just a pause. Okay, so I'm going to bend the knee, and then I'm going to rotate the, I'm going to internally rotate the foot, and then I'm going to, this is actually a test for the knee, but I'm just going to do what I remember. Okay, and now externally rotate. This, I believe, is a test for the meniscus, okay? Now for the hip, I'm going to have the patient cross his leg like this. And this is another test again for the hip. I'm going to stabilize the patient's body by putting my hand on his left iliac crest, anterior iliac crest, and then I'm going to press down this way. Does this hurt?
Yeah.
Okay, so that's, you know, he's fine, but if it wasn't, if it was painful, it could indicate some problems with his hips. Okay, I'm going to go ahead and do the spine. So I'm going to ask the patient to stand up. If at any time I remember some of the things I missed, I will do them. So I'm going to have you go ahead and stand up. What some of the things that are coming to my mind, go ahead and just stand for now. Stand up straight. Okay, I'm going, when I was doing the hands and the wrist, I didn't do two tests that I now remember. One of them is, let me adjust the camera. One of them is called the Tinel test. I have the patient hyperextend his wrist like this, and that's all he can do. And then I tap here. Does that hurt?
No.
Okay. If it did hurt, I'm tapping on the median vein. If it did hurt, it could possibly indicate carpal tunnel syndrome. The other one is where I'm going to ask him to put the backs of his hands together like this and like this. And that is called the Fallon test, and it would be for 60 seconds. Again, it would pinch the nerve. Does that hurt?
No, it's like a cramp right there.
Oh, cramp. Okay, so you can go ahead and stop. So that test is also testing the median nerve for possible carpal tunnel syndrome. Okay? All right, now we're going to go ahead and look at the spine. Go ahead and stand up straight. I am looking at, is that light too bright?
No.
Okay. Let's see. Let's see if I can. Okay, so turn sideways like this. Okay, good, just like that. Okay, so, and then stand up straight. So I'm looking at the spine now. I'm looking at the curvature of the cervix. Excuse me, I'm so sorry for that. The cervical spine and the lumbar spine, they should have a natural curvature going forward, which is lordosis. And then the dorsal spine or the thoracic spine should have a convex curve, which could be called a kyphosis curve. So that's what I'm looking at from the lateral side. Now I'm going to ask the patient to turn. Can you face that wall? Okay, and back up, back up, back up. Okay, right there. Okay, so I'm looking at the spine. I'm just doing an inspection. I'm looking at the shoulder height, the iliac crest height. Is it symmetrical? Does he look symmetrical? And then if you didn't have a shirt on, I could see the bones here. I'm looking for lateral deviations, which could indicate scoliosis. That's what I'm looking for. Also, of course, any abnormalities or deformities and things like that. So now I'm going to palpate. I'm just going to palpate the spine. I'm feeling for nodules. I'm assessing for pain and tenderness. Is there any lateral deviations? Things like that. I don't feel anything here. Now I'm going to kind of look at the hips. Are the iliac crests the same height? Yes, they are. I'm going to now ask the patient when to bend forward. I'm going to be assessing his range of motion forward. I'm going to be assessing his symmetry of movement. Are his shoulders, his shoulder blades, his hips, are they moving symmetrically as he bends forward? I'm gonna be able to see the spine again. Is it when he bends forward, does it look symmetrical? So range of motion, symmetry of movement, pain. And so that's what I'm going to ask him to do now. So I'm going to ask you to slowly bend forward like this as I look at your spine. Just do it nice and slow. Don't do anything that hurts. Go ahead. So is it symmetrical? Yes, so far so good. Okay, and then come back up slowly. Okay, now I'm going to check the range of motion. I was checking the forward range of motion. Now I'm going to check the range of motion of him going back, which would be the extension of his spine. So now I'm going to have you go like this, but don't this time you're going from your spine to bend here too. Okay, so it's very stiff in this area here. Okay, so now go ahead and, all right, so now we're going to, we just checked the forward flexion, the extension of the spine. Now we're going to do lateral movements to check for the lateral, checking the spine laterally. So now I'm going to ask you to do this. Just reach down to the side and then the other side. Reach down there. Okay. Now reach down to the other side. Okay. And now I'm going to have you go like this. Stand straight, and then just with your shoulders, just turn your shoulders one way and then the other, like that. Okay, now the other way. Did any of that hurt?
No.
Okay, now we're gonna, I'm remembering something that I wanted to check the internal rotation of the shoulders. So now that I remember, I'm gonna do it. I'm gonna have you put your hands on the back of your neck. This is an internal rotation of the shoulders. Now I'm gonna have you put your hands back here on your lower back. Bring your arms down. And this is internal rotation of the shoulders. Did any of that hurt?
No.
Okay. All right, so go ahead and put your hands to the side. Just trying to think if there's anything else I can remember. Okay, so go ahead and have a seat right here. And that's it for now. Thank you.